Hi everyone, welcome to Back to Basics. This is Dr. Asamoah. I am live from La Centera actually, and this was sort of an unexpected event. I had a dinner planned that I forgot about, and it was exactly at the same time as Back to Basics. So we are going to be short and sweet. So I am a gastroenterologist in Katy, Texas, also a functional medicine provider. Thank you guys for logging in. And as you can see, I am actually in beautiful Katy, La Centera. I'm gonna switch this over so you guys can see. And today I am actually at a dinner to learn more about a new medication for ulcerative colitis. But the focus really is our elimination program. And so I wanted to take a minute to talk about our 6-week elimination program that we just started, and we actually are going full force because it sounds like we'll probably be doing a group every single month. So we've got our July group, we have got our August group, and we've got our September group. I'm so glad you guys are on because I'm very faithful to Back to Basics. I was like, there's no way I'm not going to do this live. They will just have to wait for me. I got to talk to my family. So the elimination program came about because as a gastroenterologist, I met a lot of patients with IBS, change in bowel habits, bloating, diarrhea. Hey, Nicole, thank you for checking that it works. Change in bowel habits, skin rash. We're seeing patients with joint pain who all suspect they have some kind of food sensitivity. So they're doing allergy tests, and these regular IgE allergy tests are negative. And sometimes they're doing food sensitivity testing. You know, you can do all sorts. We've talked about food sensitivity on Back to Basics before. And they're doing food sensitivity testing, and they're picking up 40 or 50 different foods. And patients are getting frustrated because they're like, I cannot eliminate 50 different foods for 3 months or 4 weeks. So what do I do, Dr. Asamoah? And sometimes the food sensitivity testing doesn't always align with their symptoms. So they'll eliminate the foods and they still have symptoms. And, you know, it's very, very frustrating. I mean, you almost need a chef sometimes when you get your food sensitivity testing back. And I think that's because, you know, when it comes to food sensitivities, it's very different to IgE mediated food allergies. This is really because of an immune reaction going on inside the GI tract, which is leaky gut. Now, if I hear anyone say, any other provider tell my patients that they do not believe in leaky gut, that is false, false, false. Leaky gut is just a fancy term for intestinal permeability issues. It is described in all the medical literature. I mean, there are gastroenterology papers coming out talking about leaky gut, talking about the effect on the microbiome. So if you're seeing a provider, a primary care doctor, or another GI who tells you that leaky gut is not a real thing, I don't know. I would probably get another opinion, guys, because that is the evolution of medicine, and that's where Renaissance functional medicine is going, right? We understand the impact of the gut microbiome on the system. So because of that, I kind of went back to basics. Yes, I went back to basics and said, well, you know, if we didn't have food sensitivity testing, and if there's so much variability in food sensitivity testing, and if it's so frustrating for patients to deal with it, how can we simplify, right? And if you go back even to pediatric populations like children, and when you're trying to figure out if there's a food sensitivity or food reaction, what do? We eliminate that food to kind of see how reactions will develop. And so with the Institute of Functional Medicine, with even A4M, with a lot of integrative medicine courses or medicine certifications, the role of food elimination is the first step to identifying a food sensitivity. Again, guys, not allergy. Let's not get it confused. This is sensitivity from someone having leaky gut. And so I kind of went back and followed the Institute of Functional Medicine's guidelines. And this is something they always recommend. Your first step in healing the gut is doing an elimination diet. And this warrants avoiding the 8 top food allergens. And I'll list them out. I have a little video to show on that. But basically wheat, dairy, so not just gluten, but wheat, dairy, soy, egg, nuts, tree nuts, shellfish, some other fish. What else have I missed? I said soy, I said corn, And with that, you also want to eliminate processed food. That's a big part of the elimination diet, right? You don't go wheat free to then eat everything out of a bag, right? That just says non-gluten. You want to make sure that you're eating really healthy. We actually go all the way to eliminating some red meats, because unfortunately a lot of the pork and the beef we have is not organic farm raised, right? They often are not organic farm raised. A lot of the dairy that we drink is filled with antibiotics and hormones, a lot of the poultry we eat. So in that elimination process, you also want to eliminate those types of food. So when you're doing beef, if you can do beef, we sometimes don't do beef on elimination, and pork, you want to make sure that it's organic, that it's grass-fed, that it's farm raised. You want to make sure your dairy and poultry, no hormones, no antibiotics. You want to make sure that your fish is wild caught fish. So those are some of the basic things you want to do when you're eating clean on this elimination diet, along with avoiding all the 8 top allergen foods. Coffee, no, we want to detox. So we're using a protocol to help our patients reduce coffee intake. So it's not, you don't just go from 0 to nothing. You kind of cut back slowly, and we're watching out in case patients have rebound side effects. We're making sure they're on the right supplements like magnesium glycinate to combat that. We are also making sure that our patients are not taking alcohol. You can't really be doing alcohol and be on an elimination diet, right? That doesn't work. So no alcohol. We are also making sure, I'm trying to get the best light, make me look good. Okay, guys. You also want to make sure that sugar is a no-no. So we are only doing sugar naturally in foods, not increasing by, we don't want any double-digit sugars, right? So it has to be less than 9 grams, no added sugars, and we're staying away from high sugar fruits as well. So it's sort of like a clean diet, and we're doing it for 21 days. Why? Because when people have food sensitivities, you can get reactions starting from 48 hours after eating the food all the way to 21 days. It stays in your system. The immune system and the immune buildup, that complex that forms that food sensitivity that leads to leaky gut, can take up to 21 days to clear out of your system. So you definitely want to do a minimum of 21 days, and sometimes you may actually need to go on for longer. So what happens when you start reintroducing foods? Well, we reintroduce slowly, one food at a time, small portion, reintroduce over 3 days, and we're tracking every symptom that you may have with that food reintroduction, so you can really see whether this is the culprit food or not. So slow reintroduction, and you should be done with reintroduction in about 1 to 2 weeks. And you of course want to reintroduce healthy, wholesome foods, right? So that is the snapshot of the elimination diet. The goal is to figure out what are the trigger foods, but in doing so, we reset the gut, because we've kept things clean, we've kept things wholesome, we've kept things organic, and we've kept things fresh. So guys, join us maybe in August, join us in September for our 6-week elimination program. We are using insurance for this. The cash pay rate is very low, but I wanted to make sure our patients could use their insurance. We're providing a lot of education. We're providing one-on-one, so do not hesitate. So far, we've had no issues with insurance so far. And join us, join us. Let's see how this goes. And of course, we'll give good guidance after the elimination diet. After the 6 week is up, the question is what's next? And we have a little plan that we've outlined for our patients when it comes to that point, and we can help guide them for the future. So hopefully this helps everybody on the program understand their relationship with food, and hopefully develop a better relationship where they understand what to eat and what to avoid long term. Have a wonderful evening, guys. I'm gonna rush off to this educational dinner. I told them that I had a hospital call to do really quickly. I was like, forgive me, I got a hospital call. I gotta take this call. So let me rush back. Have a wonderful evening, guys. Bye-bye.